We've got a bird flu outbreak. It's driving turkey prices up 40%. Although, I don't know if you saw this before you came on the air, Joe. I just posted a moment with Merrill.
I did see it. You were hanging with the birds.
I was doing a little bit of remote work this week and had to take care of some yard work. And the turkeys just came by this morning. And they were just like, hey, we're hanging out.
No, it's up on our show Instagram, the Chris and Joe Show. Check it out.
I was getting ready to fire up the blower, and Pops comes over and he goes, hey, the turkeys are here.
How many of them did you have? I saw two in the video.
Two.
Okay.
Yeah, just two. My wife says they've been around for a few weeks now. So
okay.
But I don't spend a whole lot of time here in the Northeast studios, so I haven't seen them. We do have prices popping though, and I don't know. Maybe these birds are sick. I don't know. Maybe the birds that came by to see me this morning were bird flu turkeys. No idea. But according to some experts, they say this strain of bird flu, which is driving turkey prices up going into Thanksgiving, although experts say there are enough turkeys for Thanksgiving. But if you're a turkey at Christmas kind of person too, hard to say what you're going to have available. And our question is, if this does pass to humans, which they're warning could happen, it's already passed to some cows, cats, and other mammals, are we prepared for another pandemic? And largely, I would say, I do not believe we are.
Yeah, why do you think that's the case? We just dealt with COVID for the better part of 4 years.
Yeah, and I think COVID was also a major driver when it came to this last election. I think a lot of people were disappointed in Biden's handling of specifically the economy around COVID. But we also saw during the Biden administration, people who were fed up with masks. They were saying no to vaccines. They didn't trust the government. And that's not a new phenomenon for people not to trust the government, but it felt like the pushback was more significant this time around than say with other issues. For instance, how many people are showing up and screaming about bailouts to Argentina, right? We're not, right? No. We're just not doing that. But this one affected us very personally, and then we were told what we had to do. And if there's one thing I know, nobody likes being told what they have to do, right? Don't tell me what I have to do. I'll do what I think is in my own best interest. I don't want you to tell me what I have to do and what I can't do. And so I think that when the last election went on, and of course you see RFK Jr. become a cabinet member, I think that really is an indicator that the public is tired, that we are polarized, that the last guidance we got, which felt like it was always changing.
It was disjointed too,
Yeah, we got new information. Then they said, okay, well now social distancing really didn't do a whole lot. Masking probably didn't do a ton, but it didn't hurt anything either, right?
Yeah,
so
wear this type of mask, not that one.
Yes, and I think we got tired of it, and I think that really eroded public trust, and I think that makes it even harder to have a response by a federal system that is charged with helping us through any sort of a pandemic. And I think also from a political standpoint, I think you've got a government that says, we really screwed it up last time. Let's not do that again. Fair, right?
Yeah.
However, they didn't really put anything in place. It's kind of like the Obamacare. You've got a lot of people that don't like Obamacare. And then they go, okay, great. You want to repeal and replace. And nobody could come up with a replacement. They just know that they didn't like Obamacare, but they didn't really know what they wanted to have as a replacement. I feel we've got the same thing going on when it comes to pandemic preparedness. We know we didn't really like the way things went down last time. We just don't know what good looks like. And as a result, we're just sort of saying, well, maybe we won't have another pandemic.
I am with you 100% there. I'd also apply a lot of individual logic to this too, that I think applies to a degree to the government. We take our health for granted in this country. We choose to just hope we're not going to get sick.
Oh, that's true.
As opposed to actually doing things to prepare. Because, hey, you might prepare and you may not get sick. Then you wasted all that time preparing for what is nothing. So it's way easier to just not prepare and just pretend like it's not going to happen.
This is why Pablo and I have long conversations about retirement accounts. and I think conventional wisdom is you should save throughout your life while you're working so that when you retire, you've got money available. But then Pablo brings up a really good point. What if I don't plan on living past 65 or 67? Man, then I've saved all that money for nothing, and I could have been enjoying it now.
Yeah, but I
can't find a flaw in that logic.
Yeah, well, the Joes of the world say that's a great plan if you plan to live to 65 or 67, but what if you live to 77? What then?
Well, I think, Pablo, don't they have pods in Sweden or something we can go?
Just don't eat as much. Don't spend as much as you need it. Plus, you think when I'm 65 I can eat the same amount of food that I can eat right now?
Oh, no way.
You think when I'm 65 I can walk as much as I can walk right now?
No.
You think when I'm 65 I can be as much active as I am right now?
No, but I think you'll need...
That's why that's why I'm enjoying myself and spending my money right now so I can eat whatever I can. Walk however I want. When I'm old, I'm not going to be able to do that, Joe.
But I think you'll need more health care as you get older. You're not going to need less stuff. You're going to need more stuff.
You don't know that.
Well, if you're walking less and eating less and taking worse care of yourself,
because you're old. It's called age.
Have you seen the? In fact, Joe, you wanted to talk about this today, so we can do this after 3:00. You wanted to talk about the cost of health care. We're not going to be able to afford health care when we're that age anyway.
Hey, you know what? We probably shouldn't even worry about it. Just don't even sign up for it.
No, I'm going to start looking for a good witch doctor. I'm going to ting tang walla walla bing bang my way all the way through my senior years.
I love it. Yeah. Serious note, I think we are afraid. As an individual, think about how many times you have went in to go to your doctor and you've either omitted the truth or outright lied to them about smoking, drinking, working out. And I think to a degree, as a country, we do the same thing. I guarantee you, we lied about PPEs and we said, oh yeah, we've been stocking up. We've got them. We're prepared for the next pandemic. And then the pandemic rolls around and it's like, okay, where's the supplies? What supplies? We don't have those.
We didn't think we'd.
We are afraid. And when we're afraid, we revert to doing nothing as opposed to preparing.
So is aversion smart?
No.
So is the bottom line here basically we're dumb? We're just we just went through a pandemic. We should have learned a lesson, but we've decided it's easier not to?
Yeah. As a country, definitely. We should learn lessons from what we dealt with. And I think the lesson that we took away from it is, let's just not think about it. Let's just hope it doesn't happen again. It's way more fun to scream and yell about it as opposed to actually do something.
Boy, that's true. And in the meantime, ting tang walla walla bing bang.
I cannot wait.
You say that, Chris, but for me, as an indigenous man, that kind of stuff, those home remedies work more for me than some of this Western medicine that's been presented to me over the last 200 years.
Mm-hmm. Oh,
you got to remember, the indigenous part of me, for the last, for millennia, has relied on that, what you call walla walla bang bang. But
no. Wait a minute. Don't confuse what I'm saying for naturopathic medicines, because I do think you're right that there's some legitimacy to a lot of that. In fact, most modern medicine probably emerged from finding natural causes and figuring out how they can monetize it. But I'm talking about the people in, the remote tribes where they still don't have any human interaction, that are still like, here, eat these chicken bones, see if you feel better than me.
Or perhaps like my ex's mom, who told me when I had a sty on my eye to rub my cat's tail on it.
Oh yeah, don't do that. Yeah.
Did not work. I fell for the
Pablo,
Walla
is
Walla
that
Bing
something
Bang.
that comes from your ancestry too?
No.
Okay. All right.
I went to Dr. Walla Walla Bing
chicken
Bang.
bones, neither of that, buddy.
No.
Or more of herbs and medicines,
Yeah. That makes more sense.
Mortar and pedal, take some of the plants around you, and goodness gracious.
All right.
I got to get out of this. I got to get out.
Yeah, get out of it. Bail now.
Thanks for watching the Chris and Joe Show. Click to see more from Chris and Joe, and tap the button in the middle to subscribe to KTAR News.